Hi. So nice to hear from you again. I think your topic is really cool, and the big problem that we're going to have is that there's just a snowstorm of scholarly articles being written about this. So let me show you how I would dig around, and then we can see if any of these are going to fit the bill for you. And the tough thing is that a lot of them are going to be really short-term studies. You can't do a longitudinal study in 1 year, or can you? I'm not sure. That's a question for Dr. Yo. So here, I de-identified the topic, but I highlighted the things that we might be searching for. So COVID-19, depression, anxiety, and mental health issues. And I should have highlighted quantitative too. So I'll do that right now. We also want quantitative. So I broke that up, and I must admit I've done this search before, and I broke it up into 3 lines of keywords because we've got COVID, which has been used to describe different outbreaks, not pandemics, but epidemics. Local have been entitled COVID. So we might find some other related stuff, but like COVID 19, coronavirus, I think those are the medical colloquialisms or vernacular or the common way that they're talked about. But we want to catch any iteration of each one. And then the next line of keywords would be depression or anxiety. There might be other ways of talking about this too, but those are two really big ones. And they've been around and they've been classified as such for a long time. And then the keyword quantitative is a methodology. So let's go in, let's plug these into a database. When we first go in, we could start out here in the library catalog, but I want to go into, I have a COM guide, and we can look for it. Excuse me. This goes really slow. These are all the guides on our campus. So law, library, health sciences. So if we go to the COM guide, I actually have one for quantitative, the 3710. At least I think I do. Oh, it's right there. If you can't find it, just go to one of the bolded communication words, and then you'll find it's a tab, quantitative, right there. And there, I have some tips. I use this as a teaching guide for the class, where I'll show up to the class and give like a 20-minute pep talk. So there's different ways of approaching it. I think for trends and ideas and keywords, I think we've already covered coronavirus, COVID-19, but this is where you'd look for those alternate keywords. But I think we're all very familiar with this topic right now. But if you go into social sciences, psychology is going to be the one where depression and anxiety show up the most. But some of these other ones are going to be pretty good too. But I'll start in psych info, and we'll do our keywords. I think I've logged in today. I think I've logged in. Yay! I did log in. So you could do it here, but advanced search, let's go in that one. Let me show you some of the things you can expect. So if we have our keywords already set out, what's the problem? COVID-19. What's a disorder caused by that pandemic? And you see the and right here. The and means what it's going to do is it's going to look for everything that has COVID-19 or coronavirus or that. After it pulls out of all the psychology articles published in the last 30 years, it's going to give us a subset of articles. And then out of that subset, when we do the and, then it's going to look for everything with depression and anxiety. And then, well, you know what? I'm going to start, before I put the quantitative one in, and we want to find scholarly stuff. This is mostly scholarly, but if you run into stuff like that, there's sorting options after you get in. How many is there going to be? Over 1,000? 980 articles. That is profound. So one thing to be aware of is if you want, so there's 5 dissertations, 1 book. That's hard to believe that somebody's produced a book already. But you can do like references available. You can see here it goes back to 2011. That's related to the earlier COVID things. I think we're pretty safe in assuming that most of these are going to be about our current issue. But what you can do in this database in particular, excuse me, not all of the databases are going to do this, but this one has the ability to sort by population. Human? Oh, I'll be darned. But you can also, in this database, you can search by methodology, which is so cool. This is not a lot of databases do this, but because it's clinical psychology and it's very high level, they break it down. So what you can do with this is you can look up the methodologies you're interested in. So there's quantitative. So there's 300 articles that are quantitative. We might be good there. But what you can also do is see, are there other things, other methodologies that you're interested in? Like brain imaging, that's going to be quantitative. It's like, how did I feel about that? Like, the brain imaging was kind of cute. No, it's going to be totally quantitative. This part of your brain was bigger and this part was smaller. And mathematical model, that's going to be quantitative. So in this one, we didn't need the keyword quantitative. So this is one way of getting into it. And for your assignment that you're working on, I don't know how many you have to find, but there's other ways of differentiating if you want to. My favorite is going into subject. These are the subject headings that are produced by the authors of the articles. And so if you're interested in different things, so there's mental health, but you can look at different things going on, because everyone's going to be studying it from a different angle. They might be looking at the population. They might be looking at outcomes of particular interventions or treatments. All sorts of different ideas. So if you're doing like a literature review where you have to do a little bit of each, this is a good way of figuring out what people are talking about, if that makes sense. Income level. How fascinating. That's a big one. If you live in an area of poverty, you're less likely to have personal protection equipment or those oxygen delivery systems, and so it's much more fatal. Let's go to a different database, and let me show you the full-blown search with quantitative in there. Say you wanted to find the most important article instead of wading through 300 of them. Oh dear. Oh dear. It doesn't like it when I break through those. PsycInfo is great, but if you wanted to look at societal issues as well, so like the prevalence right now of mental health clinics and resources being overloaded because everyone wants to talk to a psychologist or a counselor, that would show up in those where it's talking about a culture or a society. So you could do the same search there. If you wanted to look in school systems, if you wanted to look at health promotion, that might be part of that as well. So there's different angles that you can go in and use those keywords. But let me show you Scopus. I may have done already, but I want to show you, because this one has a a lamer advanced search. Let me be honest, I find this search lame. It's a cool database though. So how do I do this without being able to put it into those different lines? Let me show you. There's something called nesting. If you put each one of these in parentheses, it's the same thing as adding a line. So you do a parentheses, add an and. You could do this in that PsycInfo as well, if you wanted to skip doing the advanced search. And quantitative. So this is the same thing that we did in the last search, but we built it up more deliberately with the coded language of the databases. Fingers are crossed. I haven't done this search yet. Hey, 113. That's great. Isn't that stunning? So Scopus, higher level of impact and regard and rigor. So this is kind of like PsycInfo, but it's just the greatest hits. But it also has a lot more of the social sciences. It has STEM, it has medicine, all sorts of stuff. So when we're looking at this, we can presume the quantitative is in there, but you'll have to do due diligence and look for those. But on this one, we can look for the number of times cited. And then we can know, so this one has nothing to do. This is cardiology. And so maybe depression and anxiety showed up as like something called a comorbidity, something that tagged along with all the other things like heart failure apparently. But what you can do is go through here and you can see impact on mental health in Wuhan during the 2019. Cross section, they'll tell you their methodology hopefully right out in the outset. But if you find one, so it's healthcare workers, impact on healthcare workers, that one's showing up a lot. Each one of these, oh, here's college students. Interview, survey, study. So this is interesting. How is this quantitative? Is where you will have to negotiate these things. But what we did is we sorted by number of times cited. And so if this one, it just boggles the mind that an article published in 2020 will already have 16 articles that have cited it. But that's impact. So an interview, survey, study, what does that mean? How did they quantify that? I want to look for that quantitative. Oh, it's mixed methods. Okay, so here's where you have to read the abstract. The data were analyzed through quantitative and qualitative methods. Are you allowed to use mixed methods? That's between you and your instructor or the assignment as you go. But this is how I would find things. PsycInfo, Scopus, they're going to be a great place to go. I think what you can also do is look into any of these other databases and just try them out, try different keywords and see how you go. But I think you're going to find way more than you need. It's a great topic and there's a lot being written about how do we solve these problems. Okay, let me know how it goes. Great topic. I hope we find good solutions and I hope to see everyone, including you and me, on the real campus soon once vaccinations take hold.